Hi, my name is Riley Gordon. This is my head-to-toe assessment for spring semester for my 7606-M51 pediatric clinical. Today's date is January 17th, 2023. This is the room, ceiling, floor, and this is the equipment I will be using throughout the exam. All right, throughout the exam, I will be assessing skin of the head, neck, face, anterior and posterior chest, and abdomen. I'll be looking for skin color, temperature, texture, turgor, moisture, any nevy, bruising, scarring, lesions, edema. I will be assessing, to start, I'll look at the head, inspect the head for size, symmetry, and position, midline of the shoulders. I'm going to inspect and palpate the head for hair color, hair texture, hair distribution, masses, depressions, lesions, tenderness, and infestations. I'm going to palpate the temporal arteries for tenderness, and then I'm going to palpate the lymph nodes of the head and neck, starting with the occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm going to now palpate for TMJ, open and close your mouth. There we go. For any crepitus, subluxation, and tenderness. I'm going to assess cranial nerve 5, starting with sensory. Close your eyes. Tell me when you can feel this.
Yes.
Light touch of the cheek, nose,
Yes.
forehead,
Yes.
chin. And then we assess the motor part by palpating for the masseter muscle. Clench your jaw for me. Perfect. Cranial nerve 7, which is facial nerve, looking for symmetry. Go ahead and puff your cheeks, puff your lips, smile, frown, and raise your eyebrows. Perfect. Moving on to the ears, I'm going to inspect the outer ear for position and shape. I'm going to palpate the pinna and tragus for masses and tenderness. I'm going to inspect the auditory canal for and tympanic membrane using my otoscope. Pull the ear up and back. Okay. Same thing on the other side. Up and back. Okay. I'm going to assess cranial nerve 8, which is vestibulocular. Starting with the whisper test. Go ahead and cover your left ear for me. Repeat after me.
1, 2, 3.
And then cover your right ear for me. Repeat after me.
1, 2, 3.
All right. And then we're going to do the Weber test for lateralization. Can you hear equally in both ears?
Yes.
All right. Rhyme test. Bone conduction to start. Tell me you can no longer hear it.
I can no longer hear it.
Air conduction. Same thing.
I can no longer hear it.
All right. We want air conduction to be longer than bone conduction. Same thing on this side.
Can no longer hear it. Can no longer hear it.
All right, perfect. I'm going to move on to the eyes. I'm going to inspect the brows, the lashes, and palpebral fissures and the conjunctiva and sclera for any color for the color, any drainage, and any lesions. I'm going to assess cranial nerve 2, which is gross visual acuity, and for central and peripheral vision. Go ahead and read with both eyes.
LFTPH,
And then cover your right eye for me.
LFTPH,
And then your the other eye.
LFTPH.
Perfect. And then for peripheral and central, tell me when you can see my fingers
I
dancing.
can see your fingers.
All right. And then I'm going to assess cranial nerve 3, which is ocular motor. I'm going to do that by looking for direct and consensual pupillary response to light. So look straight ahead. All right. Perfect. And then also for light, for accommodation and convergence, follow this in for me, and then we're going to come back out. Perfect. I'm going to assess cranial nerve 3 again, which is ocular motor, cranial nerve 4, retrocular, cranial nerve 6, which is abducens. I'm going to do that by looking for conjugate gaze with any extra eye ocular movements. So follow my finger. Looking for any nystagmus or extra eye ocular movements. Or extra, oh, excuse me. And then I'm going to assess for red reflex and any other internal eye structures using my right eye to assess your right eye, such as like the optic disc. And then my left eye for your left eye. Okay. And then I'm going to inspect the nose for make sure it's midline and straight. I'm going to inspect for nasal patency. Plug one nose, blow. Plug the other for me, blow. Perfect. And then I'm going to test cranial nerve 1, which is olfactory. Close your eyes, perfect. And tell me what you smell.
Vanilla.
Tell me what you smell.
Coconut.
All right. And then also I'm going to palpate this frontal sinuses. And then the maxillary sinuses for any tenderness. Okay. And then moving on to the mouth, I'm going to inspect the lips. Open up for me. You can leave your tongue. Yeah, I'm gonna look for inspect the lips, gums, teeth, tongue, buccal mucosa, salivary ducts. Raise your tongue for me for the floor of the mouth, and then for tonsils, which are absent in the posterior pharynx as well. I'm going to assess cranial nerve 9, which is glossopharyngeal, and then cranial nerve 10, which is vagus nerve. Do that by looking for soft palate and symmetrical uvular rise on phonation. So stick your tongue out and go ah. All right. And then we'll test cranial nerve 12, which is hypoglossal, by looking for midline tongue with no fasciculation. Stick your tongue out for me. Perfect. Okay. And then I'm going to move on to your neck. I'm going to palpate for palpate the trachea, make sure it's midline, and then I'm going to palpate for the thyroid gland. So go ahead and turn your head to the right for me and swallow. All right, to the left and swallow. Perfect. Palpate the carotid arteries. Turn that one and this one. And then I'm going to listen or auscultate the carotid arteries with the bell of my stethoscope for any bruits. Please hold your breath and turn your head for me. Hold your breath. Turn the other way. Hold your breath. Okay. Moving on to your posterior chest. Can you please turn around for me? I'm going to put your hair over here. Okay, all the way for me. I'm going to be comfortable. I'm going to inspect for any obvious signs of deformities and symmetry. I'm also going to inspect any signs and symptoms of respiratory distress, such as using accessory muscles, tripod position, nasal flaring, retraction, cyanosis, tachypnea. I'm going to palpate for symmetrical chest expansion. Go ahead and take a deep breath for me. Perfect. We'll palpate for tactile affirmatives. Go ahead and say 99.
99.
Keep repeating.
99, 99, 99.
Okay, perfect. I'm going to now percuss in the intercostal spaces. Going from side to side and down. All right, and then we're going to auscultate in the intercostal spaces, starting above the scapula, going from side to side using the diaphragm. Make sure I listen laterally on the right side to get the right middle lobe. Okay. And then I'm going to assess for egophony. Say E as I listen down. Perfect. All right. We're going to look for listen for bronchophony, sorry. Say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right. I'm going to listen for whisper pectoraliquid, which is whisper 1, 2, 3 for me. Okay. You can go ahead and turn around for me. Starting with the anterior chest, I'm going to inspect for any signs of obvious deformity and then also symmetry. I'm going to palpate for symmetrical chest expansion. Breathe in for me. All right. I'm going to palpate for tactile firmitus. Say 99.
99, 99, 99.
All right. Then I'm going to I'll also take now as well. Alright. Then I'm going to listen to the areas of the heart, starting with the aortic, which is the second intercostal space right of the sternal border, and then the pulmonic, which is second intercostal space left of the sternal border, the Erms point, which is third intercostal space left of the sternal border, the tricuspid, which is the fourth intercostal space left of the sternal border, and mitral, which is fifth intercostal space mid-clavicular line. Going to palpate, which is the PMI, same location. And then I'm going to listen, same spots with the bell. Okay. And then fourth intercostal space. Okay, and then I'm going to, let's see here, what was the heart? Okay, now I need you to go ahead and lean on back to 45 degrees for me, right here. Okay, and I'm going to turn your head for me that way. I'm looking for any JVD and jugular pulsations. Turn back towards me. Other side, okay. And then now you can lay flat for me. I'll move this pillow on. Under here. Inspecting for any heaves or lifts, and then I'm going to palpate each auscultation spot again. Okay, and then I'm going to re-listen to all locations once she's laying flat. Okay, and then I'm do it with my bell. And then the PMI, which is fifth intercostal space, mid-clavicular line, which is where I'm going to listen for the apical pulse for 1 minute. Heart rate is 80, sounds regular to me. And when I was palpating the auscultation points, I'm just palpating for any thrills. Moving on, I'm going to assess the abdomen. I'm going to inspect for any contours and symmetry. I'm going to auscultate with the bell for any breweries, starting with the aorta, renal, iliac, and femoral. Okay, and then I'm going to also auscultate each bowel quadrant, starting with the right lower, right upper, left upper, and left lower. I'm going to then percuss each bowel quadrant or abdomen quadrant. For any tympany, dullness, or flatness, I'm going to then palpate for any masses, tenderness, and then I'm going to palpate the spleen. Actually, okay, and then I'm going to palpate. I'm going to have to go over here. The liver. Okay, and then we're going to. You can go ahead and sit up for me. All right, and then I'm going to percuss for CVA tenderness. Okay. All right, here we go. I'm going to inspect and palpate the joints of the hands, the wrists, elbows, and shoulders for any for symmetry, crepitus, nodules, tenderness, redness, swelling, and deformities. I'm going to do range of motion. Well, actually, first I'm going to do capillary refills, and then I'm going to do radial pulses. Okay, and then now we're going to do range of motion. So you're at extension of the fingers, so flexion, extension, hyperextension, abduction, and then adduction, thumb opposition. Here you go. And then wrist, you're going to do extension, flexion, hyperextension, radial deviation, ulnar deviation, rotation. Elbows, you're going to be extension, flexion, and hyperextension. Perfect. And then shoulders, you're going to be flexion, and then, extension, flexion, hyperextension, abduct, adduct, and then circumduct, and then internal rotation and external rotation behind your head. Perfect. And then I'm going to do, I'm going to move on to, for test for cerebellar coordination with rapid alternate movement, so finger opposition, and then we're going to do hand flip-flop, start slow and speed up. All right, perfect, and then finger to nose. Yep, keep going.
Yeah.
Yep, perfect, and then do the other hand for me too. There you go. Okay, perfect. And then we're going to do rapesthesia, so close your eyes for me. And put your hands out for me. Tell me what I draw, okay?
Circle, triangle.
Perfect. And then stereogenosis, same thing. Arms, hands out. Tell me what you feel. Close your hand.
Paper cup.
And then this hand.
Coin.
All right, perfect. And then we're going to do strength of the hands. Squeeze my fingers for me. 5 out of 5. Biceps, flex up. 5 out of 5. Triceps, 5 out of 5. Shoulders, arms out. Up, 5 out of 5, down, 5 out of 5. Perfect. And then we're going to assess cranial nerve 11, which is accessory, and that is by shrugging up for me, 5 out of 5. Perfect. And then we're going to do light touch of the upper and lower extremities. So go ahead and close your eyes. Tell me when you feel this.
Feel it. Feel it. Feel it. Feel it.
Perfect. And then we're going to go ahead and move on to vibratory sensation of the wrist. Go ahead and put your arm out. Starting at the proximal ulnar prominence. Can you feel that?
Yes.
The same thing on the other side.
Yes.
And then the medial malleolus.
Yes. Yes.
All right, perfect. And then I'm going to assess and palpate the toes, ankles, knees, and hips. Looking for any redness, swelling, deformity, symmetry, tenderness, and going to palpate and do capillary refill of the toes. Palpate the dorsalis pedis pulse and the posterior tibial pulse. And then we're going to do range of motion on the toes. So same thing, your extension, flex them down the toes. There you go. And then up with the toes, out, which is up is hyperextension. Sorry, out, which is abduct. In is abduct. And then we're going to do range of motion of the ankles. So plantar flex down, dorsiflex up, inversion. Here you go. Eversion. And then you're going to do rotation for me. Okay, perfect. Then we're going to do the strength of the ankles. So go up, 5 out of 5, strength, 5 out of 5. Do strength of the knees. So pull in, 5 out of 5, push out, 5 out of 5. And up the hips, push in, 5 out of 5, and 5 out of 5. And then we're going to do deep tendon reflexes real quick. Starting with the brachioradialis. And then just relax your arm for me. There you go. That's the bicep, and then we're going to do the tricep, and then same thing on the other side, and then the patellar tendon, and then the Achilles, and then we're going to do Babinski reflex. All right, and then go ahead and stand up for me. All right, and while you're standing, just go ahead and close your eyes. I'm doing Rombergs, but seeing for any swaying or anything like that. Go ahead and jump on one foot for me. Hop on one foot, you can open your eyes. Perfect, other foot. And then go ahead and take 4 steps this way, regular steps. This is gait, and then do tandem, which is heel to toe for me back. All right, perfect. And then we're gonna do range of motion of the knees. So you're at extension, flexion, and then hyperextend on both of them. Perfect. And now the range of motion of the hips. You're at extension, so do flexion, right leg, and then hyperextension. There you go. And then you're going to do abduct, and then abduct, and then you're going to do circumduct, and then you're going to do internal rotation, and then external rotation. Perfect. All right. And then you're going to do range of motion of the lumbar spine. So you're at extension, flex for me. All right, back up, and then hyperextend, and then lateral flexion, both sides, and then rotation. Cervical spine, flexion, extension, hyperextension, lateral extension, and then rotation. All right, and then we're going to assess the spine. Go ahead and turn this way for me. And you're going to go ahead and bend over for me, flexion. And I'm going to palpate and inspect the spine. Make sure there's no scoliosis. Make sure there any abnormalities. And you're good to stand back up. I want to say that's everything.